Hello, welcome to Natural Wellness. I'm Ralph Napolitano, your host, and today we're speaking with Zoe Putnam. Zoe is the director of the Classic Center for Health and Healing in Denville, New Jersey. Zoe also is a nationally certified massage therapist and bodyworker, therapeutic touch practitioner and teacher, director of the center, as I've already said, and a member of many of the massage therapy and bodywork associations in this country. Zoe, it's a pleasure having you on the show.
Thank you, Ralph.
I'm looking forward to speaking about therapeutic touch and its incorporation into your bodywork practice and your regular professional practice. To start off, I'd just like to know a little bit about your background, how you've come to be here.
Okay. I started out life as a research psychologist, and it was a wonderful career. I enjoyed it. I still miss a couple of things about it. But after 10 years of being in a pressure cooker, I said, it's time to think about a change. And one spring, I read a book on massage. I said, oh, that's it. I started studying shiatsu and resigned my position. And a year later, I opened up the Classic Center. And we offer different types of body work for healing purposes.
That's terrific. And how long has that been now since the center's been there?
It's been about 10 years.
Excellent.
Yeah.
Excellent. A lot of changes in the healing arts in the past 10 years.
Oh, yes. It went from being something that people were not too familiar with, that you didn't discuss with the boss at work, to where today people give their bosses gift certificates for Christmas.
Right.
And the boss has to come in, I can't stand it for another minute, you know, and things like that. And we have 3 and 4 generations of families that come in.
Wow.
You know, yeah.
Now, a lot of your work today is very strongly on the therapeutic touch and what is called energetic healing.
Yes. Therapeutic touch is a magnificent healing technique. There are several things that it does very well. It relaxes you like you've never been relaxed. Really deep to the core.
That's welcome in today's hectic, crazy, chaotic world.
Yeah. If
and
it
healing.
did nothing else,
Right.
that would be worth it.
That's very healing by itself.
Yes. It also can accelerate the healing process. If there's an injury or an acute condition, it can help boost the natural healing abilities that we have. And it can be good with chronic conditions as well, emphysema, arthritis, other things that people think they have to live for a lifetime with. Maybe they don't. Not always.
Now, as a body worker, practicing therapeutic touch, which is, you know, more getting into the subtler healing energies. A lot of people, when they think of body work, they think of the classic Swedish massage with chopping motion that they see in the movies,
right,
or on
which
cruise
is
ships.
wonderful.
Which is wonderful because it is relaxing and therapeutic in its own way. But in terms of the therapeutic touch and energy work, a lot of your work then is directed more, as the name implies, therapeutically, beyond the therapeutic action of relaxation. So
Right.
a lot of people you see aren't just to come in and relax and feel good, but for specific
That's
therapy.
right. Naturally, I see people who do have injuries, who do have conditions that are known to be helped by therapeutic touch and other healing modalities. But also, I see people that you would never expect. For example, I've seen a couple of women who came in for infertility. Now, you know that, excuse me, a massage therapist is the last person that you would call for an infertility problem.
Right. That makes sense.
Yeah. So they tried everybody else first, okay? And I guess in desperation, they tried healing body work, and there were 2 little baby girls out there who were conceived because each of the mother's body was able to take the healing and run with it, to use it to its own best advantage. And in about 3 or 4 months, after 3 or 4 months' work, they conceived.
That's very uncommon for anyone to do that, but particularly to go to a body worker and have that done.
Yes.
So obviously what you do is beyond body work. It's body work and beyond.
It is.
And the results can be far-reaching.
Yes. I used to put limits on what I thought could be done. but I don't put limits anymore. If a person comes with an unusual situation or calls on the phone and they say, "Can you help with this?" I tell them very honestly, "I don't know, but I can't rule it out."
Mm-hmm.
And then we go ahead and try.
Right, because again, you know that whatever you are going to do is not going to harm them.
That's right.
There will be no harm in trying it, and you've seen many cases where it has done good where you might not have normally expected it to.
That's right. You don't know what capabilities nature and the body has.
Mm-hmm.
You know, sometimes the body can get into a corner and it doesn't know how to get out, but it wants to get out. You know, it wants to be well. It wants to function in optimum capability.
Mm-hmm.
You know, and it may not take a whole lot for it to be able to do it. It just needs to be shown how. And I think therapeutic touch shows the energy a new way of behaving, a balanced way of behaving. And energy might be erratic or bumpy or blocked or going in the wrong direction at a rapid speed, you know. But therapeutic touch will take that energy and say, here's how we want to be. We want to be peaceful, smooth, flowing, healthy, open. And when you show the energy how to be, very often it can take that and work with it. Sometimes once is enough, fantastically. I remember one woman who had TMJ, which is a problem with her jaw.
Right.
She had it for 7 years. She didn't see me for that. She saw me because she had lower back pain. We worked with the lower back pain. And because of the success of that, as she was leaving, she said, "Oh, I've had this pain in my jaw for 7 years. Do you think you could help with that?" Well, I said, "Oh, you mean right here?" And that was the end of it. Her body was so ready to be healed that all you had to do was say, "Oh, right here," and it was gone. She called me 2 years later to say that it hadn't come back.
Wow.
Yeah.
That's phenomenal.
So you can't say because something's been there for 7 years that the body's just going to hang on to it forever. It may be looking for the least excuse to get rid of it.
Wow. That is a phenomenal example. I have heard, though, more in the psychological realm, neurolinguistic programming, they say that healing is instantaneous. Getting up to that point might take years.
Okay. That's true, too.
The idea, though, of doing therapeutic touch and energy work as a body worker, I guess the first presumption or assumption that is made is that people are more than just flesh and bones. I mean, for anybody tuning in, whether they're body workers or they're just lay people interested in the subject, the first step is understanding that according to quantum physics and the new science, that, you know, everything is energy, vibrating at different speeds, and that if that is so, and we'll take that again as the assumption, then energy can work with energy. Energy can be altered.
Yes.
And sensed through practice.
Absolutely. I'm sorry.
No, please continue.
Einstein told us back in 1905 that energy equals matter. C square is a correction for the speed of light. If we recognize that energy equals matter, then matter equals energy. Equals means they're the same. The vibrations might be different, the frequencies might be different, but it's energy. And it's almost as though a therapeutic touch, instead of thinking of the body as solid, you think of the body as energy.
Right.
And that energy, that grouping of energies that we call me, is in constant interaction with the environment. The energy comes in, it's processed, it goes out. We send things into the cosmos, we take from the cosmos. You can say that life, perhaps, is a universal force in the same way that gravity is. Perhaps it might be appropriate to say that healing is a universal force, that healing is a universal energy.
It's a natural,
very
occurring,
natural.
Right.
Yes, and that it's out there. when you do therapeutic touch, it's as though you're taking universal healing energy and introducing that into an imbalanced grouping of energy called the client.
Mm-hmm.
All right? And you try to send through energies that are appropriate and healing for that person.
Now, this would sound like far out, quasi-science if it were not the fact that there's a lot of documentation and research done to prove that many of these concepts are correct, indeed truth.
Yes. In the realm of physics, physicists have been doing studies for the last century, and they keep coming up with the fact that Einstein was correct.
And in the realm of healing?
And in the realm of healing, studies have been done. Dolores Krieger, one of the two women who founded Therapeutic Touch, claims that she introduced her research, not the modality.
Mm-hmm.
So her research showed way back in the early 70s that doing therapeutic touch, in fact, alters blood chemistry. It increases the hematocrit ratio and the blood hemoglobin count. And many studies have been done since then showing that healing is in fact accelerated.
And it's well accepted within the medical establishment. The first line of acceptance of therapeutic touch was really among nurses and hospitals.
That's where it was born.
Right.
Yes.
And as far as I know, tens of thousands of nurses around the world have learned this technique and use it to a greater or lesser degree within a hospital setting.
That's right. That's right. It's been taught in about 80 countries now.
Mm-hmm.
And in this country alone, it's in many hospitals, in many operating rooms, in many mental hospitals where people are maybe okay physically,
mm-hmm.
but psychologically they're not well. Autistic children, people with depression, not so much with people with schizophrenia,
mm-hmm.
not too many successes there. But
there have been studies and successes in all these other areas.
Oh, yeah.
With therapeutic touch.
Oh, yeah.
One thing that has surprised me, and a reason I was so looking forward to having you as a guest, is that while it has been well embraced within the classical or Western medical model, a lot of body workers have not yet incorporated the concepts or precepts of therapeutic touch or therapeutic touch practice into their own practice.
Yes.
And you're doing it.
Yes. Therapeutic touch started out life at NYU.
Mm-hmm.
In 1976, it was incorporated into the curriculum there in the Graduate School of Nursing. And since that time, while tens of thousands of nurses and other health professionals and even lay people have learned it, it hasn't yet hit all of the bodywork profession as much as it should.
Right.
Not enough body workers are aware of it. Part of the reason is that it takes a while to cultivate people to be able to teach it.
Mm-hmm.
So now that some of us are ready, we're out there teaching it to body workers, and the response is wonderful because a body worker can incorporate it into their practice no matter what else they're doing.
Right.
Whether it be neuromuscular therapy or shiatsu or Swedish massage, whatever it might be, you can incorporate it in and help the person even more than you might have otherwise.
Yeah, I'd like to see the day that when someone calls a body worker, they can expect that part of what they will receive in their treatment will be energy-based, therapeutic touch type of work and healing.
I think we'll see that.
Back to the whole concept of, person as energy field, you mentioned that really what you see yourself doing is introducing a certain vibration through you to the energy field, which is your client or patient at the time. And sort of that alone helps them to regulate themselves. All healing actually happens within the person being healed.
That's right, Ralph.
And all energy that you use comes through you, not from you necessarily.
That's right. It's universal,
mm-hmm.
and it's there at your disposal. And when you send the energy through the person, it's retraining their energy, is what it is. It's showing the energy here instead of being erratic and going in 90 different directions. Remember what it felt like to be calm and peaceful and healthy and orderly? Mm-hmm. Dora Kunz, the other woman who was the developer of therapeutic touch, says that health, in fact, is order, that the universe is working towards order. And although at the same time it's very chaotic
and disorderly,
the movement toward order is where health comes. So she trains us to always try to move towards order and peace.
And looked at, again, if one can truly embrace the concept that we're energetic beings at our core, if you introduce a vibration into a field of vibration, very often things start to resonate at the same vibration. I mean, I've seen that demonstrated with tuning forks, where if you take one and have it vibrating, you'll actually get the other to vibrate when you haven't even hit it. And that may be an example for people to understand better how the energy coming from one utilizing therapeutic touch can help.
That's a good example.
To normalize.
That's excellent. And when you send it through in one place, it reverberates through the rest of the body as well. And when doing therapeutic touch, as a matter of fact, you send the energy through. So it's not, you're not putting it to just a local area. You're sending it through the body, or you might send it down and out the feet, so that it reaches different, it can reach the whole field, I guess is what I'm trying to say.
Right. And although you may be working with a particular client for a specific request they might have, at the same time, more importantly perhaps, you're working on the whole.
Yes. If a person has a headache, for example, you would not limit yourself to working with the head.
Right.
You would balance the entire energy field. Yeah. If they have an injury, you might be tempted to work more with the injury.
And it might not hurt to do that.
Yeah.
However, the ideal is, and to keep in mind, is that you're helping the organism as a whole to heal itself.
Exactly.
And to get energetically into sync.
That's right.
With the healing vibration.
That's right.
Whatever that may be. The use of therapeutic touch in a bodywork practice, how hard a sell was that 10 years ago, initially, when you started doing it?
Well, it was a pretty hard sell, yes, because nobody knew about it. Today, at least, people know about it, and massage therapists are very familiar with all the techniques that are out there, or most of the techniques, at least by name.
Right.
So when they come upon someone who's teaching it and offering a class, they're more or less knowledgeable already. I've noticed in my beginner classes that a lot of people have a good base of knowledge. As a body worker, it comes as no surprise to you that energy is healing and that the body, in fact, is energy. Only because you see some very unusual things that cannot be accounted for in the physical realm.
Right.
When I first went into bodywork, I studied a technique called shiatsu. Magnificent technique. It's also a healing technique.
Originally from Japan?
Yes.
Right.
You had to practice on 5 people a week. Now, this had to be 5 people who loved you, because it took 2 hours and you didn't know what you were doing.
And it could sometimes be painful.
Yeah. So one of the people that allowed me to work on her was my dearest friend. Now, she had osteoarthritis in both hips. So severe that she would take up to 14 pain pills in a day.
Wow.
The first 5 or 6 weeks, I went over to her home, and she was lying down on the floor practically before I came in the door. She was just ready for me to work on her. But this particular week, I came in, and she brings me into the kitchen, and we're chatting. She offers me a cup of tea, and we're chatting some more. Finally, she gets up the nerve, and she says to me, "So is it okay if we don't do my legs today?" I said, "Of course." Encouraged, she said, "Is it okay if we don't do my back today?" I said, "Honey, we don't have to do anything today. Don't worry about my homework. What's the matter?" She said, "I just hurt so much, I can't even picture somebody touching my body."
Mm-hmm.
I said, "Well, you lie down and let me just try something else." At the time, what I did was I just superficially ran my hand over her entire body. It took about an hour. I didn't know what I was doing then. It was called superficial effleurage. And when I was done, she jumped up. She was exhilarated. She called me the next day at 2 o'clock and she said, "You know, I was up till 1 o'clock last night." And I said, "Oh, I'm so sorry." She said, "No, I was doing the dishes. I was doing the things I couldn't get done." She said, "I expected to take 4 more pain pills before I could go to bed, but I didn't take any." She said, "And I waited to see how long I could go before I took any today. And it was just now, so I'm just calling you."
Wow. That must have been an eye-opener for you.
I had goose pimples. The tears were running down my cheeks. In 6 weeks, she was off medication. I continued to work with her. And it took a year for her to get off body work.
Mm-hmm.
That was about 10 years ago, and she's had no symptoms since. That's when I started looking around. What did I do?
And how can I do more of it?
And how can I do more?
Right.
Well, it was my compassion for her and my focused intent that brought about the change. And those are keys in therapeutic touch. And it took me 2 years to find it.
Right. Those are key elements of therapeutic touch.
Exactly.
Is having the compassion, having the intention, and the focus to work and help somebody.
Yes.
In fact, many massage therapists and body workers, no doubt, unofficially are practicing therapeutic touch in their normal practice. Elements of it.
Elements of it.
Certainly not as a modality and not formally, but just having the intent to heal people and to help them and to work with them
is very helpful.
They're having beneficial effect on levels that far beyond the bodies that they're working on. I mean, just the physical outside they might be working on. In utilizing this healing energy, this therapeutic touch, you mentioned when we were speaking before that you try at this point not to have any expectation of what can and can't be done with it.
Yes. I used to have a pretty clear idea of you can do this with this technique and you can do the other thing with the other technique, you know. And therapeutic touch was for A, B, and C. Actually, there shouldn't be any limitations on what can be done by therapeutic touch or any other healing technique. If a person has a situation that has not been helped before by me using therapeutic touch, I can't at all say that it wouldn't help, because the technique is very, very powerful, and there's no end to what nature can do. And therapeutic touch is a boost to nature. And by changing the energies, by helping them do things in a more orderly way, or by boosting them, you are in fact augmenting the natural process of healing. And to put a limitation on that and to think that something can't be accomplished is ridiculous. You know, we have a tendency to think that cancers can't be cured.
And yet they are.
They are all the time.
Spontaneous healings
All the
and
time.
remissions, right?
Yes. Dee was with a woman one time who had liver cancer. There were also 50 other people around. And the question put to Dee was, what's wrong with this person? You know, it's like a little test. It doesn't take long to feel that a person has liver cancer. And then she did a treatment. The 50 people around were in harmony with this young lady and had tremendous compassion. Dee was able to take that tremendous compassion and send it through And the person, after that healing session, test showed she no longer had liver cancer. She was 24 years old.
Right. And this is another documented case.
Documented case.
Of therapeutic touch in application. And it's just one example of the clinical experiences that have been recorded that show the efficacy of this modality, that more and more people need to become aware of. And I believe expect their body worker or any healing arts practitioner they're dealing with to have some knowledge of and some ability to use on some level in the future. Obviously, your work in teaching it is bringing some of that about. Do you find an eager audience?
Yes. Yes, people are very excited. And they refer to it as a watershed weekend. There's the weekend before therapeutic touch, and then therapeutic touch, and then after. It just changes your life.
That's excellent. I want to get into that in the next segment. We're going to wrap up this one now, but I do want to talk about how therapeutic touch affects the practitioner as well as the people that they're working with.
Okay.
Zoe, thanks a lot for being here.
Thank you, Ralph.
And thank you for tuning in. Until next time, be well. Hello, welcome to Natural Wellness. I'm Ralph Napolitano, your host, and today our guest is Zoe Putnam, director of the Classic Center for Health and Healing in Denville, New Jersey, and teacher of therapeutic touch as well as practitioner. Zoe, this is part 2. We've already covered a bit of information on therapeutic touch. We gave a basic grounding initially, but I'd like to again, for people who might not have seen the first segment, get a sense of an overview of therapeutic touch and you with therapeutic touch.
Okay.
50 words or less.
Therapeutic touch is an energy healing technique that is done actually above the body. The practitioner centers herself or himself. And from this place of center, takes their hands and scans over the body in this fashion. Okay. Feeling for cues. And when you feel a cue that represents an imbalance, you put it in your mind because it's going to need rebalancing later. You assess the whole body, the whole field, and then you go back and you start the rebalancing process. And the rebalancing consists of reassessing as you're going along.
So it's a constant dance almost.
It is a dance.
An energy dance, if you will.
Yes. It takes about maybe 20-25 minutes for a session. And generally speaking, you would rest for maybe 10 or 15 minutes afterwards.
As the person who received the session?
The client,
right.
Yes, that's right.
So that helps it to sink in and start to do its work more.
Exactly.
Right.
Yes, before you go off in other directions. I found therapeutic touch in 1991, and I studied with Dee, of course, and it was something that I had been looking for a couple of years, and it was marvelous. You can't believe what you can feel with your hands. You know, we see a lot with our eyes,
right.
and we hear a lot, and we're used to that. We're not used to being able to feel so much with your hands.
And that comes from practice?
Comes from practice, yes. I will say that beginner students can already pick up quite a little bit.
And as I understand, too, for people who, maybe practitioners watching, even if you can't feel it, you can still do good. You don't have to necessarily have refined senses to start with.
That's right.
And still have a beneficial effect.
You can work on what I call a gross level. You can work with the big things that you do feel. Virtually anyone can do therapeutic touch. It's a natural potential.
Right.
With the novice will feel certain large things, like, for example, if a person has a very severe migraine, They might be able to feel perhaps heat around the head. They would work with what they found. Whatever you find is what you work with.
And as I understand it, how you would work with that, if you as a practitioner sensed heat, you would send coolness through you.
Yes, that would be one good way of...
Sort of opposites on a gross
That's one
level.
good way of doing it, is using the principle of opposites.
Mm-hmm.
Yes. Somehow that helps the energy cancel out.
But it's also very subjective. You know, when you talk about canceling it out, or using opposites or whatever it is, it really these are all just representations for things that we really don't truly see. It's not seeing when it's more sensing, and it's beyond normal sense. I think Barbara Brennan calls it higher sense perception.
Yes, yes.
Than the normal 5.
And that's right. And it's very difficult to put English words on some of these things because...
And we tend to interpret it through the normal 5.
Mm-hmm.
So we'll say, oh, it's heat, or it's, I see a light, but it might not be, but we have to interpret it through what we know.
Exactly. And the heat is not something that would register on a Fahrenheit or Celsius scale.
Mm-hmm.
We perceive it as heat, perhaps, but like you say, we have to interpret it somehow, and we need to communicate it somehow.
Without the clinical proof and all the research that's been done with therapeutic touch and similar energy healing modalities, I mean, there would be certainly a lot more skepticism, I believe, out there, healthy skepticism. But with all the clinical proof, with all of the research that has been done, with all of the papers that have been written in hospitals, in a scientific medical setting, this has to be taken seriously by people.
Yes, yes. There are still people out there, in spite of all the studies, who say that that it hasn't been shown to be helpful. That's okay. That's okay. It doesn't make any difference in a way, because if it's helpful to someone, then they tell someone else. And then if it's helpful to them, they tell someone else. It's a upswelling of people who know that energy body work of various types is helpful. And they don't so much care if somebody is a skeptic or somebody says, no, that's not true. It just doesn't make any difference. I had one woman come into the office one time who had chest pain. She had already been to the cardiologist, and she had already been to the pulmonologist. So her heart, she was told, was fine. She was told that her lungs were fine. She was convinced that she had lung cancer. She even had been to a gastroenterologist in case it had been her esophagus.
Mm-hmm.
She came to me, and really it took seconds to discover where the pain was. It was not near her heart or her esophagus. It was in the bronchial tubes. And then it took about maybe a minute or a minute and a half to get it to go away. I think what that was probably a spasm in one of the tiny bronchioles, that the spasm just hung on there and was so painful that she was convinced that it was some large problem.
Well, in my own experience, people tend, when something is hurting, they tend to tighten around that area, and it becomes bigger.
Exactly.
Organically.
Needless to say, she drives her friends to my office.
Yeah, that would be needless to say.
She doesn't care if there's any skeptics.
Like, for her, that's a miracle.
Yes.
Having gone through that experience.
Exactly.
The ability to get to the point, to sense where you can sense. Obviously, it's going to be different with everyone, time-wise.
Mm-hmm.
It's time in the water. You don't learn to swim on land.
Mm-hmm.
You learn by getting in the water and doing it, developing the sensitivity.
Mm-hmm.
But for yourself, you started learning in '91. At what point did you feel maybe a breakthrough? I don't think you'll ever stop learning and getting, having different experiences, but a breakthrough experience for you after.
I think perhaps a breakthrough might have come when I finally started to be able to relax with the idea that I can feel it, and it's really there. And it probably took about 2 years before I felt that I was getting a nice full picture of what was going on. Yeah. It took me about 2 years to be able to pick up, for example, the fact that a person used to smoke 20 years ago.
Mm-hmm.
All right? Prior to that time, if they had had smoker's cough or some
You could tell.
large evidence of it, I would have been able to tell, surely. But when that happened, I said, wow, okay. You know, that was a milestone for me.
Mm-hmm.
And then to be able to pick up such things as, oh, who is it of your parents or who in your family has diabetes? Because I could feel in the energy over the pancreas that this person did not. At the same time, I could feel that it was there in the history
potential was there or
somewhere.
something, right?
Exactly. Exactly. The history representing a potential.
Right, so the more you do the work, you would find yourself picking up things beyond what was even necessarily there physically for that person.
Right.
Again, going back to what we discussed in the first segment, the whole idea of energy as being universal. Everything is energy, vibrating at different speeds. That being the case, we can, according to that theory, access information beyond what's right here and now.
Yeah, it's all there.
It's all interconnected.
It is.
It is all, if it's truly all one, as most of the basic philosophies and religions of the world teach at their core, then that's one of the ways we can demonstrate it scientifically. That idea of quantum physics, everything being energy and being one.
Yeah.
And the hologram.
Yeah.
The idea that each piece contains a representation of the whole.
Yeah, there's no question in my mind that that's accurate.
Well, you've seen it. I mean, you've worked with it. You've seen the direct result of doing the work within that realm. When you teach therapeutic touch now to body workers, one of the things we touched on was your philosophy for teaching. You have a beginner, intermediate, and advanced level. Can you give me a little bit more information on that philosophy for the students?
Yes. My feeling is that I like to give the students as much information as possible. I feel that, yes, you do need to learn some things experientially, but I like you to have the knowledge in your head so that you can experience it that much sooner, and that, in fact, you can expect it.
So you therefore give more points of reference to look for?
I do.
Okay.
I give a lot. In the beginner class, the person learns everything they need to know to be able to go out and do therapeutic touch successfully. I've had...
Which is not real complex, as I understand.
The concepts are
very
not.
Basic, right?
Yes.
Okay.
I had a student call me with such excitement several months ago. After she finished the 2-day beginner class, she ran into someone about 3-4 days later who had multiple sclerosis and was in a wheelchair. He was 35 years old, very depressed because he had been told he had 4 years to live.
Wow.
He hadn't been out of the wheelchair, I think, for about 5 years. This beginner worked on him, and he got up out of the wheelchair and, with help, walked. Now, I don't want to say he was cured of his multiple sclerosis. He was not. But what that did was that lifted his depression. That enabled him to look at life with a little bit more of hope and being a participant instead of an observer. And he had to go home to Scotland, and they found someone in Scotland who was going to continue to work with him. But that's what you can do if you have the knowledge. You don't necessarily need a whole lot of experience to start helping people in a real way.
By just grasping the fundamentals of therapeutic touch and beginning the practice, even for lay people, can have a beneficial effect from the outset.
This was a lay person.
Oh, fabulous.
Yes. Yes, a person who works at one of the offices in New Jersey.
Mm-hmm.
Yeah.
So for people already practicing bodywork to add this to their arsenal, if you will, or their repertoire, they would, right from the start, be able to possibly see some beneficial effects as well,
Yeah.
you know, within their practice from utilizing some of this.
Yes, I think the more sensitive body workers are probably halfway there anyway. They're probably already very focused.
They're just not doing it officially, they're unofficially practicing.
Right. They may not have the discipline of knowing the full scope of how to use therapeutic touch. So they would love it. They would just fall right in.
I wanted very much to touch on the effect that therapeutic touch has on the practitioner, as well as the healee, as Dee Krieger calls them. You've experienced it, you've seen it with other people, your contemporaries, that you know, your peers in learning it and practicing it. Can you describe a bit of what goes on within the practitioner as they continue their progress with TT?
When you're consistently centering yourself, you are balancing your own energies, so that your energies were just as erratic as anyone else's. I, for example, came from a pressure cooker. Many people do. When you consistently center, you change all that. The stress leaves. The imbalances soften and become more balanced. And that's not with doing a session on yourself. That's merely preparing to help someone else. Now, in helping someone else, in doing a treatment session, compassion is so important to the success of therapeutic touch. In being compassionate, however many times in a given week, for however long each session, experiencing compassion, being centered, you end up by being very compassionate, even if you didn't start there. Okay? It's as though by pretending to be somewhere or to be someone, you are.
Act as if you are until you are.
Exactly.
Right. There's an old phrase in sales training which is "fake it till you make it." You know?
Okay.
You know, if you act as if, at some point, you know, from being that way, you will achieve what it is that you're emulating initially.
Compassion is a very deep inner expression. It really, you mentioned core earlier. It's something else that comes from your core, and maybe it's touching the heavens or being one with some good forces. I don't know.
Right, and there's many names for it, and you know, to keep it non-sectarian, people can choose whatever name they want. But there is touching that universal oneness or highest good or whatever it might be.
Yeah.
The other aspect of therapeutic touch that I believe has a beneficial effect on the practitioner is the idea of intention, focusing intention. You mentioned compassion, and I know that one of the main principles is also having the intention to help and to heal.
That's right.
And focused intention is something, again, that I believe bounces back and helps the practitioner.
It does. I saw that firsthand in myself a couple of years back. I had a urinary bladder infection, and you know, on the first day I didn't pay any mind to it, and second day, third day, fourth day. By the fourth day it was so painful to urinate, and the urine was so cloudy that I couldn't put it off any longer. And I said, well, before I make an appointment for the sulfa drugs or whatever you use, let me just see if I can help it myself. So I sat on the edge of the bed, and I put my hands down by my urinary bladder. I closed my eyes and I focused. and I intended that it be well. It was like the flash of a camera. I literally could see the flash go off inside my bladder, and that was the end of it.
Mm-hmm.
There was no more infection after that. I don't know where the cloudy urine went.
Somehow it was cleared up.
It disappeared,
Right.
yes. And there was no more problem. So by being focused and having your intent to heal or to help heal, it retrains you so that as you do it, you become better at it.
Mm-hmm.
As you try to help someone, whether it be yourself or someone else, every single time you try to do that, that helps you be better at it for the next time.
Right.
You know?
In teaching, again, you have an beginning, intermediate, and advanced in your own teaching. And I know in TT they also sort of divide it up that way without real clear demarcation, but that is sort of a way of looking at it. The main progress is made through practice after learning the fundamentals and having a sense of what to look for in your progress. Would that capture the essence of what it is you teach?
Yes, it would. Yeah. Progress is made by always coming back to the basics. There's no need to be in a hurry when you're working with someone.
Mm-hmm.
As a matter of fact, I tell my students, if there's a client who's wrapping their fingers and going like this, checking their watch, just stop. Have a little conversation with the client. If they're not ready for a session right then and there, fine. Do it another time.
Mm-hmm.
If they are, then relax and go with the flow.
Right.
Okay? The fastest way to get there is slowly. If you want to become very skilled at doing therapeutic touch, there's no need to do many sophisticated things. Just come back and center, be compassionate, work with what you find, and that's how you make your most progress.
And as with anything else, I would imagine it's consistency of practice more than intensity of practice that will make true progress.
Yeah.
You know, that you're doing it and making it a part of, again, whether it's a layperson or a body worker or even an RN doing it in a hospital environment, doing it consistently.
That's right. And if for some reason you're not able to be consistent, if a certain amount of time goes by, you don't really need to take a refresher course.
Mm-hmm.
Pick up your notes from class.
And there's
Or
great books out there.
read a book on
Dee's
it.
written several books.
Dee has written several wonderful books.
Right. And Dee, we were referring to as Dolores Krieger for those who are tuning in that don't know.
That's right.
And you can find them, the books, pretty much every
they're all
bookstore.
over.
They're all in print, I believe.
Yes.
The idea of more body workers embracing therapeutic touch, you're obviously in your own life working towards that by going out there and teaching.
Mm-hmm.
Your reason for that is that you believe strongly that it should be more universally available.
Yes. It's such a marvelous technique. It's good for the practitioner. It's good for the client. It spreads peace. It spreads compassion. It spreads healing. I would like to see it in the pocket of everyone,
Mm-hmm.
but certainly as a tool for therapists, all types of therapists. Yeah, body workers in particular, because to my point of view, it is a body work technique.
Right.
Yeah.
But just working with the energy body more than, or the physical body.
Right.
The practitioners that you teach must find, I'm assuming, but they must find that the level of their work goes up, that they're able to be more effective for their clients/patients.
I get phone calls all the time.
And they don't have to work as hard for the results that they get. In a way, they work easier for better results.
Right, right. And they continue to be stupefied by what can be done so simply.
Mm-hmm.
You know, that's not to say that therapeutic touch can do everything. It cannot.
I don't believe there are any panaceas, unfortunately.
No, no.
Or fortunately.
Different people need different things.
Mm-hmm.
And just because therapeutic touch doesn't work with a person does not mean that that person doesn't want to be healed. What that might mean is that that particular technique is not the best avenue to
For
accomplish
them
it.
at that time.
Exactly.
And
Maybe homeopathy might be just the right thing.
Right, it doesn't mean that they don't want to be healed. It also doesn't mean that therapeutic touch doesn't work. It just doesn't work for them at that time.
That's right.
Right. And homeopathy might work, and there are so many other viable things to try. And again, the key is back to Hippocrates, do no harm.
Mm-hmm.
First, do no harm. And we know that this technique has never been known to harm anyone.
That's right.
The core, again, back to that word core, but the key for teaching
Mm-hmm.
when you teach is what, if you had to sum that up? I mean, we're getting into about 2 minutes, I guess, to go. So.
Okay. When I teach therapeutic touch, I try to teach every concept, every aspect, and share all my experiences.
Mm-hmm.
Now, not all of my experiences are appropriate, let's say, for a beginner class, but many of them are. And in sharing, a person learns. And I think, as we may have joked earlier, you don't need to have a baby to be an obstetrician,
Right.
you know. And it's the same with therapeutic touch. You don't need to be terribly experienced to be able to grasp some of the experiences that others have had.
Mm-hmm.
And you can incorporate that knowledge, and that knowledge gives you more seasoning. It gives you more knowledge so that you can turn around and help others more.
Right, success leaves clues.
Yes.
And what you try to do then is uncover some of those clues for your students.
Yes.
And then they can see how to proceed along that path successfully.
Mm-hmm.
Fabulous. Well, I thank you very much again for being here. We may have to do this again, actually.
Okay.
There's so much more that we could talk
It's
about.
been fun.
Thanks. I've enjoyed it. Hope you have too. Until next time, thanks for tuning in, and be well.